So I want to talk to you guys a little bit about the process of nutrition response testing and essentially how we establish our system of communication with the body. So if we were to say like a simple analogy, a cell phone. I don't know many people that could actually explain to me how a cell phone works, but you totally accept the reality that if you dial a number and you hear ring, 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 and that person's phone receives the signal, they can say hello and you can communicate. And you could do that at the speed of your voice anywhere in the world. Can anybody really explain how that happens? Maybe if you work for a phone company or do more engineering, but we just for the most part accept the fact that there is a transmission of a signal with a hello and a hello response. Same premise, same idea revolves around nutrition response testing. We have to establish a system of communication. And the way that we do that is by achieving what is called a locked muscle. I tell my patients that the locked muscle is the most important thing that they understand because it sets the table for how we do our testing, how we communicate with this body. So you need to understand a very simple principle. This body has energy. My body has energy, so does yours. Now, even though it is muscle testing based off some energy, it's also some neurological testing. Because in order for us to get a locked muscle, the brain must send a signal to the muscles and then it gets a response. So for example, I would have Tara hold her right arm straight out for me. Now we could use the right arm, the right or the left leg. It's just the easiest muscle of choice for myself as a practitioner. So what I'm gonna do here is, Tara, I'm gonna push down on your arm and I'm gonna ask you to push back up into my hand. If the body does its job, the brain will send a signal to the shoulder and the muscle will become tight to the point that it locks. So this is not about strength. I think that anybody watching could see that I'm a little bit bigger than Tara. I'm probably a little bit stronger than her, so I could muscle her, but it's not gonna be about strength. It's gonna be about a lock. So all right, Tara, I'm gonna push down on the arm a little bit. When I do that, just push back into my hand. And what I'm looking for is that we get a nice locked muscle. All right, Tara, you ready? Here we go. So I push down on the arm and it locks in place very nice. I push down on the arm again and we still maintain having a locked muscle. Now you may not get the full realm of this on video, but I'm gonna try to accentuate this so that you can see it. All right, Tara, this time I'm gonna push a little bit harder. You ready? So I'm gonna push, I'm gonna push, I'm gonna push, and the arm still stays nice and solid. Now, if you notice, she wasn't shaking, she wasn't trembling, but I leaned on her entire body with my body, and the arm maintained a locked position. That locked muscle is the singular most important thing that we establish in order to test and train a patient. So now once we have that, Tara, do you feel pretty confident with the locked muscle there? All right, perfect. We have one part of communication, locked muscle. Now I have to show her and teach her what we call an unlocked muscle. Because in our testing, we're gonna find parts of the body that are happy, well, healthy, they stay locked. And then we're gonna find parts of the body that are stress deficient or some sort of toxicity is plaguing them and they will go weak. So the last thing we wanna do with anybody is end up in an arm wrestling match. So we've got our first clear note of what a lock is. The next one is gonna be what an unlock is. And the way that we show a patient this is by touching a little point, a little reflex between the eyes on the bridge of the nose. There's a very long scientific explanation for this. I like to keep it simple. So Tara, I'm just gonna touch this point between the eyes on the bridge of your nose and we're gonna see what happens. Is that fair? Okay. So first thing we do, I re-verify, does she have a locked muscle? There it is, perfect. I'm now gonna come in, I'm gonna contact this point between the eyes on the bridge of the nose. I have a locked muscle. I'm going to flip and she no longer can hold it. I'm gonna flip back. I have a lock. I'm gonna flip back and she no longer can hold it. Now, how does that happen? I won't leave you without some thinking points on that. Have you ever heard of the expression opposites attract? Do you know where that comes from? It comes from the basis of magnets and polarity. So we could say this body has energy. This body has energy. This reflex between the eyes is one of the most energetic points of the human body. So when I hit that point and our energies were the same, they opposed, they pushed away, the arm got weak. When our energies were different, the opposite, the attraction, she maintained a lock. Now that's way more than it's pertinent for anything that's important regarding the testing. I just don't want you thinking, well, all he did was this and he pushed harder. That's not at all what happens. So once we've established, okay, Tara, so we know what a lock is, feel good about that? And then you notice this change? You notice that change? So now that we can communicate, all right, Tara, your job is to always give me a locked muscle, but if and when you feel a part of the body go weak, just let it go, don't fight me. Can we do that? All right, now we are ready for the next step of the initial consultation, which is known as the body scan. And a standard body scan is going to allow us to examine every organ and gland in the body, starting with the brain, working all the way down to the kidneys. Now this is a non-invasive procedure, so this is the point of an exam where somebody goes, wait a second, how are you going to test all of my organs and glands if this is a non-invasive procedure? I don't want to get too scientific or medical, but in that realm, what we are going to do is we are going to apply ischemic pressure to the dermatomes of each of the organs. So we're not actually contacting the organ, but its reflex site. So when I say reflex, what do I mean? At some point you've been in a doctor's office, you or your children, and that doctor's pulled out that little metal hammer and they pop you in the knee. If your knee jumps, you have a reflex there. Just like your muscles have reflexes, so does your organs. And that's what we're going to get into in testing here. So Tara, we're going to make this real simple. One of two things is going to happen. Well, we're going to say three things. The first is any organ that goes weak, I don't want you to fear, worry, or panic. It's just simply maybe the underlying root of dysfunction to why the body has a symptom. But we're going to find one of two readings. We're going to find a locked muscle for an organ or gland that is responding appropriately. It has enough energy in it to do its body. An organ or a gland that goes weak doesn't represent grave danger or stress, but it's the body's way of saying there's not enough energy in that organ. I'll show you and then I'll explain a little bit more. So the next thing we're going to do is we're going to scan her body and we're going to go through the following key organ points. We're going to test and check her frontal brain, the top of her brain, the crown, the cerebellum, her pituitary, frontal sinus, eyes, maxillary sinus, upper jaw, lower jaw, tonsils, thyroid, right lung, left lung, thymus gland, heart, spleen, stomach, liver, gallbladder, pancreas, small intestines, ascending, transverse, descending, sigmoid colon, ovaries, uterus, bladder on women, bladder and prostates on men, and then the back points we're going to check adrenals and kidneys on both the right and the left sides. Once we know through that culmination of testing, we're going to have some pinpoint accuracy to know what in this body is functioning well and what has a state of dysfunction. Because I can promise you this, at the root of any symptom or diagnosis out there, you have a lack of function. And that's why I've said in previous videos and education, we do not treat or diagnose disease. We don't have to. Quite frankly, I don't want to. Because what we know is the symptom is the effect. It is never the cause. So if this patient came into me and say, for example, she had, and this is actually a real case I'll give you. She comes in, she's got a concern of cardiomyopathy. She's got a cardiac issue. But I find that the thyroid is the root cause of this body's dysfunction. Handle the thyroid, 6 months later, patient comes back blown away that the cardiologist says she no longer has cardiomyopathy because the heart couldn't be fixed until the thyroid was in her case. So in this process, we have the ability to detect what parts of the body are working versus which ones are dysfunctional. Now, a common question is, okay, well, Jimmy, I can accept the locked muscle, I can accept the unlocked muscle, but how did you just touch the thyroid, for example, and the arm goes weak? So I want to give you a principle that I'm sure you're very aware of, and I think it'll make perfect sense to this. The principle of hypothermia. What does that have to do with this? Now, in my office, I like to preach to people that God designed us so perfectly that we were designed to heal and thrive, which is true, but He also designed these bodies to survive. So hypothermia is a survival mechanism. If Tara fell into a frozen lake and went into a state of hypothermia, the areas that she'd be in danger of losing first would be her extremities. Why? We all like our arms, legs, fingers, and toes, but we don't need them to survive. We do, however, need our lungs, our liver, our brain, our intestines. So once we find a locked muscle, the body says, I have enough energy to give my extremity some. But if I put a mild stress, like pushing on an organ, so if I push on her thyroid, and that gland is so deficient and so weak that this little surface pressure causes the nervous system to shut down the extremity strength and return it to the core. We have this amazing ability, and we've knocked out successes for decades with this technology. If this non-invasive, complete system, this proprietary system that we have of analyzing nutritional deficiencies and organ dysfunction sounds like that it might be something of interest to you, please check us out at Scaringi Nutrition and Wellness. If you're not in our immediate area, practitioners like myself are plentiful. There are thousands of us around the country. Check out somebody in your neighborhood that offers nutrition response testing and be blown away.